Let's move on now to another big story, on this one involving former President Biden. He's just getting a message today of support from the UK. King Charles writing a private letter to the former president. Buckingham Palace has confirmed this to NewsNation a short time ago. So the letter is in from the king, who's of course also undergoing treatment for an unspecified form of cancer, which is what we learned about President Biden over the weekend. His cancer diagnosis, this aggressive form of prostate cancer. Let's bring in Dr. Justin Dubin on this, urologist who joins us with his take on, well, a couple of things, doctor, that I want to ask you about. I think the first big picture, we heard aggressive form of prostate cancer. So what would you say about President Biden's actual prognosis, 82 years of age, and receiving a diagnosis like this right now?
So first off, anytime you hear the diagnosis of aggressive cancer that is spread to the bone, you're always thinking condolences to the president. I'm sorry that he's been going through this. You never wish anyone to have prostate cancer. Now, there's a lot of different factors going on, right? His overall health, his general life expectancy, other comorbidities. So it's really hard in many ways to come up with a general lifespan expectation. We do know, fortunately, that prostate cancer has made many advances over the years, and people can continue to live long, satisfying lives even with metastatic prostate cancer.
Okay, now the question becomes, and I won't ask any political questions, but I think the medical question becomes, when you hear about the president, how long would he have known, or should someone have known about this, given who he is and what role he was in as president of the United States? It's stage 4 prostate cancer, right? In his most recent medical report that was released, which was only a summary, it's not like we get every single thing in the medical report, February of 24, they said President Biden's a healthy, active, robust 81-year-old male who remains fit to successfully execute the duties of the presidency. Okay, that was from his doctor, Kevin O'Connor. But if you had stage 4 prostate cancer and it was not disclosed at that time, is that because it was not tested for, or is it actually possible that it could have been tested for and not uncovered?
It's a really good question, and honestly, it's hard to answer. So according to the American Urology Association guidelines, we recommend screening from the ages of 45 to 70 if you're high risk, starting at the age of 40. Now, we also have other things considering life expectancy. If you're a healthy person, you can continue after the age of 70. This is all shared decision making. Obviously, you have a former president here who is a high profile person. Now, it's really hard to say whether they're following the guidelines, whether there was a conversation between the doctor and President Biden. It's really hard to say because a lot of this can be dependent on the conversation between the patient and the doctor.
Which would say he had aged out sort of the guidelines, right? Okay, so let's just ask this then, for the sake of argument. Say that he was the sitting president of the United States who at the time was considering running for another 4 years as president of the United States, which would get him to the age of 86, that the decision was made, again, hypothetically, to say, no, we need to test for these types of things. We need to know. So if they did test, would they have definitely found something like this, or is it possible that in a test it would not have showed up if they actually did test?
So in general, the chances of finding, when someone's diagnosed with prostate cancer and a new diagnosis in the United States, around 5% of these men are still diagnosed with metastatic prostate cancer at the time, even in the situations of screening. So is it out of the question that they, could have found something? Maybe, who knows, right? Could it have been seen earlier? We don't know. In general, it takes about 5 to 10 years for prostate cancer to become metastatic to the point where it's at your bone, getting to your bones. Mm-hmm. So it's really hard to say because it is a more common thing than you'd expect to still diagnose someone with prostate cancer and still find prostate cancer in their bones.
Okay, Dr. Dubin, thank you for your expertise on all this. Thanks for coming on. We appreciate it. Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.